Thanks very much, Rob, and thanks to everyone for coming to Garvan today to hear about some of the work that's going on and to give you a bit of education about immunology. Yep. Okay. So as Rob said, I work on immunodeficiencies, and we'll get to that in a sec. But what I just want to give you an introduction to is obviously the immune system. Yes. In general, like the immune system, like every system in our body, when it works, you don't appreciate how well it works. So obviously what the immune system does, it's really the fortress of our castle, which is our body, of course, to keep us healthy by preventing disease, particularly infectious disease. So the immune system does some wonderful things. It's like, as I said, it's pretty much an army of helper cells which can do things like have control and initiate inflammatory responses. We have other cells which I work on, as does Rob, the B cells which make antibodies, and the antibodies are the proteins which protect us against infection. We have other cells of the immune system which go in and kill cells that are infected with pathogens, particularly viruses. And there's other fantastic cells of the immune system which gobble up a whole lot of infected cells also. So these are the guys that we're trying to protect us from, these different sort of microbes, bacteria, viruses, fungi, mycobacteria, all these sorts of baddies that are out there, whose real mission is to survive themselves, but of course to do that they need to infect hosts. So I think looking at this slide here, what this shows us is actually the lifespan over thousands of years, expected lifespan over thousands of years. So just ignore the red line for a second, but all these other lines pretty much overlap. And that's drawn from historical data going actually back to thousands of years pre-BC, which predicted that the lifespan then, up until about the 1800s, was only about 25 years of age or so for 40 or 50% of people. So myself, and probably everyone in this audience, if we were alive 200 years ago, we probably wouldn't be alive at all, because the life expectancy was so short. And that was really due to the prevalence of infectious disease and essentially our inability to control these different types of infections. But what you know about today, of course, at least in the UK 15 years ago, our life expectancy today is 80 years or plus or so. So what's happened between the Stone Age and today? And it's not as if the body's suddenly acquired a whole lot of super immune genes which keep us alive. What's really changed is three fundamental changes to life which impact on the immune system. The first one was the introduction of improvements in hygiene. This was in the 1800s. The simple fact of washing your hands, keeping yourself clean. That was the first, which today, of course, it's hard to believe we didn't do that. But the awareness of hygiene was important. The next one, of course, was the development and implementation of incredibly successful vaccination programs. And then the introduction in the 1900s of antibiotics. So the collections of these three advances led to minimizing infection by improved hygiene, treating infection with the development of antibiotics, and preventing infection by the development and implementation of vaccines. But as you've already heard from the talks this morning and just now, the immune system can also go a little bit off the rails. And that's really the focus of a lot of the work that's done here and, of course, many other places. So while the immune system is fantastic at keeping us healthy, sometimes things go not quite the way they're supposed to. And that can result in, as Cheryl's just told us, and Rob spoke earlier about things like asthma and allergy, which we hear a lot about. There's many autoimmune diseases, systemic lupus erythematosus, inflammatory bowel disease, diabetes, arthritis, and many, many others, of course, multiple sclerosis. There's types of cancer, so the immune system not only protects us against infection, but because some types of infection can cause cancer, the immune system is actually very important for what's called tumor surveillance, which keeps a lookout for cells that have become cancerous. But also we can have cancer of immune cells themselves, so things like lymphoma, which we hear a lot about, leukemia, these are all cancers of the blood cells. And then what I want to talk about briefly, or highlight some of the work that I do, is in this field of immunodeficiency. And we hear a lot about immunodeficiency in the context of HIV infection, for instance. That's an acquired immune deficiency, which, as the name suggests, you acquire it due to an infection. There's also other types of acquired immune deficiencies that can occur when you, for instance, are stressed, or when you get poisoned or have chemotherapy or things like this. But what I work on are actually genetic diseases. So these are diseases which are caused by mutations in single genes. So these are called primary immunodeficiencies, sorry about that, primary immunodeficiencies, and they're often referred to as experiments of nature. These are naturally occurring conditions which happen because there's a mistake or an error in a single gene. So in our genome, there's about 25 or 30,000 genes. And a lot of those genes we can actually function quite happily without, because there's lots of ways of making up for those mistakes. But there's about 250 genes have been identified, and actually I was at a meeting a few weeks ago where they report on the latest findings of genes. So this number will increases almost every week, to be honest. But there's been about 250 genes identified out of our genome of 25,000, so about at least 1% of our genes are absolutely critical for our immune system to operate, because if you lack one of these genes, you can have what's called a primary immunodeficiency. Now, the good thing is these conditions are incredibly rare. They can affect about 1 in 100,000 to literally 1 or 2 individuals in the world. So they're incredibly rare conditions, which is obviously a good thing. However, they're incredibly informative as well, because we know these patients get very sick. They present to clinicians with recurring infections, usually from a very young age. So obviously they appear early on childhood. But they're incredibly informative and educational to us, because what they do, they can tell us why those kids get sick so dramatically. They can inform us about how we can develop new treatments for these diseases. It tells us what those genes do and why they're so important and why they can't be replaced by other genes. And it can lead to the development of new ways of treating these conditions as well. So to highlight this, I want to give you an example of 2 boys. One you may recognize. This is me as a 7-year-old. As you can see, I'm a fairly healthy, strapping young lad. And by that stage of my life, I was in school, I was playing sport, I was probably rolling around in the dirt, I was swimming, I was getting hugs from my mother. But this little guy was born not long after me, actually. His name's David Vetter. And you probably better know him as the boy in the bubble. He was a real person. He was born in 1970, just after I was. But unlike myself, this is David, when he was about 7, he spent all of his 12 and a half years literally confined in a sterile plastic bubble. Now, there's obviously ethics and moral questions about whether that was right or not. But he didn't have any of those childhood experiences that I did. He didn't actually get held by his mother until he was 7 years of age. And then he tragically died when he was about 12 and a half, following a failed bone marrow transplant. But the main difference between myself and David, obviously apart from the geographical ones and so on, was one gene. He had a gene, an error in a gene, and that caused a disease called Xlinked severe combined immunodeficiency. So he had one gene that didn't work, and that rendered him susceptible to almost every pathogen that you could name: bacteria, viruses, fungi, mycobacteria, lots of things that we deal with on a day-to-day basis and don't even realize we're infected with, like our skin, for instance, believe it or not, is crawling with bacteria. All these sorts of things really compromise the immune system, and that's why David spent his life in a bubble. So I work on a disease, a number of diseases. One is called X-linked lymphoproliferative disease. Now, the name doesn't really have to resonate with you at all. One point to make, though, is it's X-linked, and Cheryl made a comment earlier, which we may echo here. It's a disease like the disease that David Vetter had. It's carried by the mums. So the mothers are healthy, but they pass it on only to their sons. So 50% of boys born to carrier mums can have this disease or have any X-linked disease, like colour blindness and so on. So it's carried by the mums, passed on to the boys, And what's unique about this disease is that it's triggered really by exposure to a pathogen or a virus called Epstein-Barr virus. Now, you may have heard of that, but if you haven't, you've probably got Epstein-Barr virus. This is a virus which is ubiquitous. It's in more than 90% of our population in the Western world, and most of us get infected, and most of us deal with the infection without even knowing we're infected. And if you do get sick, the worst thing that can happen is you can develop glandular fever, which is also called the kissing disease, because that's how it's transmitted, usually by those active immunosuppressed high school and university students. So what we do, we work with boys and their families with this disease. We study their immune cells. We look at proteins in their cells because they don't have this particular protein here. We can see it's missing. We look in their DNA and work out why their protein can't be expressed, and we do lots of studies to try to understand why the lack of this single protein really compromises these kids' health to a virus, which is really quite common. Now, as my title suggested, we study diseases in rare groups, but we try to have our studies have great applicability to the masses. And that's shown here. So I'm always asked, oh, well, you study these rare diseases, how can that possibly help me? And that's not an unreasonable question. But Epstein-Barr virus, as I said, it causes glandular fever. Now, that's not so bad. I had glandular fever when I was 21, and I obviously survived. But it's a bit of a nuisance. But that's not all. EBV was discovered 50 years ago, 1964, to be the first pathogen that can cause cancer. So it's what's called oncogenic or cancer-causing. And EBV is strongly associated with many of these malignancies listed here: Burkitt's lymphoma, Hodgkin's lymphoma, non-Hodgkin's lymphoma, B-cell lymphoma, and a few other more fancy names like nasopharyngeal carcinoma, which is actually quite common in Asians, and leiomyosarcoma, which is a cancer of muscle cells. So it's incredibly problematic in some different demographics and some different ethnic backgrounds. And obviously it's absolutely causative of this disease that I work on. It's actually questioned. It's implicated, but not really sure whether it's involved in these. But these two columns here really highlight the applicability of here. So what most studies are focused on is studying these rare patients with these problems with dealing with infections, which can actually be problematic in the greater society. So by studying these boys and their families, hopefully we'll be able to work out ways of boosting immunity to things like Epstein-Barr virus, but also developing a vaccine, because as I said, EBV causes glandular fever, infectious mononucleosis, but can also cause numbers of cancers. So if we can prevent infection with EBV, we can prevent cancer. And of course, there's a great precedent for that. And we all know about Gardasil, which is the vaccine developed by Ian Fraser and his colleagues in the US, which is the first vaccine against a cancer. And that works because it prevents infection with human papillomavirus, which is a virus that causes warts, amongst other things. But of course, it can cause cervical cancer. So we can actually vaccinate against cancer by targeting the immune system against a virus, which we know can cause malignancies. So, and I should say, there's no vaccine against EBV. So if we can use our knowledge to convert that to a vaccine, we can treat lots of conditions and maybe prevent some cancers. So there's lots of reasons to study the immune system, and you hear about this in the news all the time, whether you appreciate it or not. Most recently, we've heard a lot about Ebola virus, obviously, rapid, almost desperate measures to try to implement a vaccine for that. A few years ago, it was bird flu. There's always things like HIV, malaria, tuberculosis that are being discussed about how these infections don't have good vaccines against them. And then there's other diseases which affect different populations of people, as I mentioned, autoimmune diseases, cancer, asthma, and my favorite condition over here, of course. So it's really valuable to study the immune system, because really without it, you're prone to all sorts of infections and other conditions. And with it, if it goes too wrong, you can have all these sorts of conditions happening as well. Thanks.